Well, the aftermath of Hurricane Helene can be felt across the nation, including in hospitals and other healthcare providers. News 4's Anthony Ramos joins us now live in the studio with more on how that impact is being felt. Anthony?
Well, Joe, healthcare facilities across the nation, as you mentioned, feeling the impacts of Hurricane Helene as that powerful storm disrupted operations at a major IV fluid supply chain, causing a shortage in supplies in facilities across the nation. Now, the good news is our renowned medical center frequently practices prepared readiness to make sure that they keep enough supplies on hand during critical events like this. Now, Baxter International, that's one of the world's leading suppliers of IV fluid, they were forced to temporarily halt operations at its North Cove plant in North Carolina. And on Saturday, the U.S. Center for Disease Control and Prevention issuing a health advisory about the shortages. Now, that particular plant supplies 60% of the nation's IV fluids to various healthcare providers, including Reno. And so far, the hospital has implemented several measures to maintain the levels of IV fluid they need for critical operations, including their Hospital Incident Command System, which helps monitor supply levels with several partners across the state.
We continue to be prepared and are monitoring the situation that's ever evolving very closely, doing everything that we can to maintain our supplies with various different suppliers, as well as working with our governmental agencies, both locally and nationally, to ensure that our community has the IV fluids that they need when they need them.
Now, I also reached out to the Northern Nevada Health System to see how they're handling the shortages, and they sent me a statement that reads in part, Northern Nevada Health System is actively monitoring the IV fluid shortage, and we have protocols in place for daily monitoring of our supply chain. Operations at Northern Nevada Medical Center, Sierra Medical Center, and our freestanding emergency departments remains the same. And coming up tonight at 11, we'll dive deeper into some of the changes that Reno has in place to better monitor their IV fluid levels on a local level. Live in studio, Anthony Ramos, News 4.